Ok, deixa eu ver aqui. Natangira. Okay, welcome back to our presentation. To continue where Raisa stopped, I would like to also to emphasize on what he said about the COVID-19 surveillance. So maybe what I'm going to take you through is the COVID-19 testing for case monitoring. But before I take you through the current situation, what we are doing currently, I would like maybe to go a bit back and talk about the previous techniques that we use. So at the beginning of the pandemics, all samples collected from different health facilities were received at the national lab and were performed using the PCR kit. So this was a very, very huge work whereby we received more than 100,000 samples per day, and then we had to employ a lot of staffs to ensure that we can respect the TAT. The TAT was were 48 hours. Then after that, because it was a lot of work, the team of Rwandan scientists came up with a very good techniques, which was pooling. The pooling was a technique which was about to take 10 samples and pour them in one tube. And then that sample will be tested on one sample. This has reduced very well the TAT, and then people were able to now have their result in a few hours. However, the TAT was reduced, but at the national lab. So NLL also thought about another approach of introducing the rapid test. The rapid tests were introduced and were successfully helped in serving the people. What a national lab did, he trained men for health facilities, including the health centers, to use the rapid test. Currently, all the health facilities are able to test COVID using the rapid test. It was not only helping the health facilities to test rapid test, but also national lab created the hubs. We call them the COVID hubs, to also help doing the PCR, so that all the samples will not come to national lab. That we can call it like one phase, what was successfully done. Then second, it was from also RBC, also thought about smart testing. The smart testing is a technique where help now the surveillance team to understand or to have a quick sight of the COVID status in a country. This mass testing is done by sampling the some sectors and also sample people, and then we can get the result in 3 days. So means in 3 days we will be able to have the site, a good sight of the COVID status. So that was considered as another successful phase 2. Then